Today we're going to talk a little bit more about the reasons we have for cardiac imaging. And we can use both CT and MRI for cardiac imaging, and there are different reasons for using both. But we're mostly going to talk about MR today because you can see the anatomy so well. The reasons for doing cardiac imaging are to view the anatomy, the function, and the pathology. And we won't talk about pathology a lot today because this is not a pathology class, but we'll touch on it briefly. So for the anatomy, we'll talk about the different chambers of the heart. And very often you will see a two chamber, not quite as often a three chamber. Four chamber where you will see both the left ventricle and atrium and the right ventricle and atrium at the same time. And they do horizontal long axis and vertical long axis views through the left ventricle as well. And you're able to visualize the septum between the two ventricles of the heart and all of the vessels, the aorta, the vena cava, pulmonary arteries and veins, as well as the valves. When you can get some great MR imaging, you can see aortic, mitral, pulmonary, and tricuspid valves, and in CT sometimes as well. There are reasons to look for the function of the heart, both in how the heart pumps and then also the blood flow. If there's a valve that's not working correctly, or if there's some flow that's somehow seeping back into one of the chambers of the heart when it shouldn't be there, you will see a bright white or a dark spot of flow during the flow sequences, and it will be interesting for you to visualize that and see what happens when you have a flow that's not going in the correct direction. And then in terms of pathology, you can see tumors, and when somebody's had a heart attack, there's some myocardial scarring. We won't visualize much of this today. I will show you the blood velocity and and the blood flow, and if it's not going in the correct direction, I will show you an image of that. And then also you can see the valves in either post-surgical repair or before they do the repair and when they're not functioning correctly. And also tumors and cancers and that sort of thing. So the first view that we're going to focus on is the two-chamber view, and sometimes this is called a pseudo two-chamber view because you're starting with a traditional axial slice. You can see on this image over here on the left that you have anterior, right, and you don't see the posterior and left. But if it were an angled slice, you would see that it says, it has two letters here, like it might say RA or RL or RO. So it might give you a little bit of an angle, and we'll see that a little bit later on in the images. But this is a true axial slice through the patient, so there is no angulation. And because of that, we are not going to catch the left ventricle in its true angle in the body because the heart sits at a slight angle with the top of the ventricle being a little bit more superior and the apex of the ventricle being a little bit more inferior. And so the angle that it sits at in the heart does not allow you to get directly through it in this traditional axial slice. But this is what you need to start with in order to get the two-chamber and four-chamber views. So you view this image and you try to get a slice of the left ventricle that is at its thickest here. And you can see the thick wall surrounding it, what distinguishes the left ventricle. And you're looking for the apex of the ventricle here, the apex of the heart, and you want to get through the mitral valve. And you're not seeing the mitral valve here well, and that's one of the reasons why it's just a pseudo two-chamber heart. But you can see here on this Netter's view, and this is again Netter's 6th edition. Make sure you're looking at the 6th if you're trying to find this image, and plate 213. And you can see the mitral valve here, and you would want to do a slice that goes through the mitral valve and through the apex of the heart here. And so this will give you pseudo two-chamber heart, which will give you the left atrium and the left ventricle. So one of the things that I had forgotten to mention in the last slide is that along with the apex and the mitral valve that you are using to create the pseudo two-chamber view, you also want to look for the septum in the heart, and you want to match up your angle and use the septum as a guide to match the line, to match the angulation. So that way you can use the mitral valve and the apex and the septum and try to come as close as you can to an angle that will go directly through the left chamber of the heart. When you do this, you get this pseudo two-chamber view, which gives you the left ventricle, the left atrium, and the mitral valve here. You can barely see it, but it's sort of a thin, dark line here on either side that's the mitral valve. And from this, then we would most likely do another two-chamber heart that's a little bit more accurate by getting an angled slice here through the left chamber and the left atrium of the heart. And that would give you a more direct axial, so it would be an oblique axial. And then then you would be able to get a better two-chamber heart off of that. You would actually angle through the left ventricle and the left atrium, and it would give you a really nice two-chamber heart. And I have just gone ahead and used that two-chamber heart, um, the the true two-chamber heart, instead of taking you through the entire sequence of how to get that. And now we're taking a look at that two-chamber heart, and I'm actually going to run the cine, and you can see what it looks like when you're watching the heart pump. So you can see the left ventricle here and the left atrium here, and the pulmonary veins are bringing blood back from the lungs into the left atrium, and it's pumping blood into the left ventricle, and then from there it will go out through the aorta to the rest of the body, up and around. Now, to get the four-chamber heart, what you would like to do is get a axial oblique view of the heart through the left ventricle and the left atrium. And this will give you the four-chamber view of the heart. Now, because it's prescribed off of the left ventricle and the left atrium, you're going to see that the best. You may not necessarily see the right as well, but you're going to see it pretty well. So you take it through the apex again and the mitral valve, and then up through the left atrium of the heart, and that gives you the left ventricle here and the left atrium. You can start to see the pulmonary vein here coming in, the left pulmonary vein coming into the left atrium, but you don't see the right pulmonary vein much at all. And then here's the right ventricle and the right atrium. So this is a pseudo four-chamber heart. You're not seeing the right side quite as well as the left side, but you see both of them fairly well. Remember when I showed you in the beginning a traditional axial slice and how you had only one letter on each side of the page? Well, now you can start to see you might just have a superior and an inferior here, but here you have anterior left and posterior right. So anytime you have an oblique angle, you may have two letters or more than two letters to create the oblique. And oblique, some people call it oblique, some oblique. Down here, you even start to get into three letters to explain the type of oblique that you're in. So just pay attention to that when you're looking at images to orient you, to let you know that you are not in a standard axial, coronal, or sagittal view, but that you are in an oblique view. So in order to get a traditional four-chamber heart, and some people call it four-chamber real, everybody has their way of expressing what type of view that it is. But rather than a pseudo four-chamber, you're trying to get a true four-chamber heart where you're really seeing the left ventricle and the left atrium and the right ventricle and right atrium as best as you can for all four. It's very challenging to do. To get all of them in one plane, but you're still going off that left ventricle and left anterior or left atrium slice. So you're going off the two-chamber heart, the best one that you have, and you're going to use that same angulation as best you can, because you're also going to use two other images to create this. So you're going to do your best to try to line up the apex of the heart and the mitral valve and the left atrium. Sorry, my cursor went away again. So the apex, the mitral valve, and the left atrium. And you're also going to use some of the short axis views. And in order to create the short axis, I didn't walk you through this, but you're going to create sagittals off of this sort of oblique sagittal plane. You're going to cut through the heart this way, just little sections going this way through the heart so that you catch both the left ventricle and the right ventricle together at the same time. It would be taking a slice this way through the heart as well. So starting at the apex and working your way up through the atrium of the heart. So you'll see both ventricles together and you'll see both atriums together. And that's what you're seeing here. So you want to try to get through the left ventricle as best you can here. And again, that left ventricle is distinguished by the thicker wall. And then you want to go just slightly inferior to the left ventricle outflow tract, which is where the left ventricle dumps into the aorta. So just underneath where that is. Sorry, my cursor is gone again. There it is. So you want to go just below where this area is here. And then when you do that, when you get these three um, angles lined up as best you can, you will get a fairly realistic view, a good view of both the right and the left sides of the heart together. And here you have the left ventricle and the left atrium again. And you can tell that this slice is just slightly different than the slice I showed you in the previous slide, because now you can see the left pulmonary vein and the right pulmonary vein, both of them together going into the left atrium. So it's a little bit different angulation. And then you see the right atrium and the right ventricle as well. And now you can see the tricuspid valve as well as the mitral valve. So it's a little better image, a little better angulation to visualize all four chambers than that last slide that I showed you. Using that four-chamber view, you can create a cinematography, a video of actually what's happening within the heart. This gives the radiologist a great view of what is happening with the chambers and the atriums. I'm sorry, the ventricles and the atriums. And you can tell here there's a little bit of motion. You can see ripples here, almost like ripples in the water. The patient is moving slightly or maybe breathing just a little bit differently, and it's not being able to be gated perfectly. But terrific view of the whole heart and how it's working as it's pumping. In order to take a look at flow quantification, which is looking at flow within a vessel and sometimes comparing it to flow within other vessels within the cardiac system, you want to take a oblique coronal slice. And you can tell this is an oblique because you have more than one letter here on the side. This is a right anterior and a superior anterior, a left posterior, and an inferior posterior. So you can tell that this is an oblique angle first through the body coronally. And this is the left ventricle and the aorta, and this is the aortic valve here. And they're going to go just distally, just past the aortic valve and do a slice, an axial slice, an oblique axial slice. And then if you were going to look at regurgitation, you may want to do a slice just inferior, just proximal to the aortic valve. And so you end up with this axial oblique here, and you're looking right at the aorta in the middle. And so I just wanted to outline that so that you can see it real easily. And in the next image, we're going to take a look at the flow through that. And it looks like a static image. It looks like you're not quite tuned in on your TV if you're old enough to remember those days. Oh, sorry, I went one too many. And we're just going to take a look at that flow. And this actually is fairly good flow. You might think that these little outlying areas here are not quite right, but that's not actually the case. It's because you're seeing this is the vessel right here, and you're seeing just outside the vessel area. So there's a lot of um, turbulence going on right around those areas, but it's right within the middle that we're looking at, and that area is actually pretty clean. I'm going to show you in the next slide another video of an area that's not, and you can see the difference. And I'm going to just go ahead and move this forward to about 4 minutes so that you can see what it looks like. About here. So while that might be more information that you need, you can tell that there's something that's not quite right within the flow of this area here. And it's different than what we saw on the patient scan that I showed you previously, where it was fairly normal signal all the way through. So I just wanted to give you that information so that you could see a little bit more about some of the pathology that you might see, or maybe a valve, the insufficiency of the valve, as he called it. The valve's not quite working correctly, and that's the kind of imaging that you'll do in order to see that regurgitation. And this is a much longer video, as you can see, it's about 13 minutes, but that 1 minute just gave you the information of how different it can be when a patient has normal working valves and valves that aren't quite working correctly. So I apologize on that last slide. I thought that you could hear the recording as I could, but apparently this computer system can't pick up both the microphone that I'm using and the system communications at the same time. So you may want to go back and listen to that video just between minutes 4 and 5 if you want more information, but it's a little technical even for me. And so it may be more than you want to know, but it was just important to show the regurgitation. Now we're going to switch gears a little bit and take a look at CT. So this is a post-image processing. So they reconstruct the images after they have done axial slices through the body. And sometimes they'll look at the arterial system. Sometimes they'll look at the venous system. Now we're looking at the arteries, although you will see some contrast coming through the vein right through here. So that's a lot of contrast here. That is not calcification. And this is the aorta here and the heart, and you'll see a little blush in the kidneys on either side and a lot of oral contrast in the small bowel, and the aorta comes all the way down, and you will see the common iliac arteries here, left and right, and then you'll also see it branch into the external and internal iliac arteries. And the little areas of white along the way are some calcium. You'll see this. This is not calcium up here. This large vessel with that's actually contrast coming through. But you'll see little bits of calcium in the aorta. See a little bit more calcium. This may or may not be contrast, but I'm going to spin these images so you can see a little bit better. But little bits of calcium along the way that you can see. We're going to turn this around here. So now you can see the aorta sagittally. So this is the anterior of the body. This is posterior. You can see the kidneys sitting out and back. You can see the aorta wrapping up and around here. And then the common iliac arteries here, internal and external. And we'll keep turning the image around. And CT is fantastic for this. You're able to see the whole arterial system all the way down and kind of separate out most of the rest of the anatomy, but you can still see parts of it so that you can get some sort of landmarks as to where you are. So CT is really good at looking for calcium, and that's a lot of what they do. They can also look at valves, and there's some great imaging with CT as well, but the MR just shows it, I think, that much better, and you're able to see it in the cine mode as well, so you can see it as it's actually pumping and the blood is flowing. And I think that it was just a better set of images for being able to show you what I want to show you in terms of the axial oblique scanning and the sagittal and coronal oblique scanning as well, so that you're able to see the various chambers of the heart without having to reconstruct it. You're just able to scan the patient as they are in the scanner, and that is the beauty of MR.